Good morning and welcome to Global Healthcast, brought to you by Global Health Press. In this podcast series, once a week, we bring to you news and views about infectious diseases, vaccines, and vaccination. I am Joe Schmitt, and as always, with me is Dr. Melvin Sanicas. Good morning, Melvin. Good morning to Switzerland.
Good morning, Professor Schmitt, and good morning, good afternoon, or good evening to those who are watching us or listening to us today.
Today we have a little bit few topics, less than usual. We cover avian flu update, the global situation. Melvin will talk on pasteurization and of milk to avoid H5N1 infection, on childhood obesity and the risk of dengue, on social media and vaccine uptake. And I'm covering the impact of pneumococcal vaccination in a theoretical study from the United Kingdom. And as I start with an update, it is on avian flu. We covered recently several times. And what you see here on this overview is avian flu viruses in the Western Pacific region in the last 20 years or so. What you see here is H5N1. There were 243 cases, 139 fatal. That is more than half. And they were reported from various countries in this time frame. Besides H5N1, there's H5N6, and again, 90 laboratory confirmed cases and 35 deaths in a roughly 10-year period. H3N8, again, last case from China about a year ago, there were 3 cases and 1 death. Then we have H7N4 in China. Then we have H7N9 in China, and you see here 1,568 cases, 616 deaths, a third to a half. And then we have H9N2 and H10N3. So it's not only H5N1 in the United States. This is the example from the Western Pacific region. Now let's go a little bit to what we covered in our last Global Healthcast, and that's H5N1 in the United States. This is data that I downloaded yesterday from the CDC website. What you see here, there is no indication of unusual influenza activity in people. That's good. The outbreak is in the United States, which is northern hemisphere, and the seasonal influenza virus is not circulating at all, so there is no concern. The concern starts if there is human influenza A circulating and co-circulating with an avian influenza outbreak, and because then the two viruses, they can meet in one melting pot in a human that has both infections, or in a cow or in a bird that has both infections. There's recombination and a new virus then that is able to jump to humans, and that's transmissible from human to human. Again, today there is no concern. The total number of reported cases of H5N1 in the USA is 5 since 2022. We already covered the 4 cases from the past that followed exposure to dairy cows, and there was 1 report on exposure to poultry. Of concern is certainly, if you look at the big numbers, wild bird, there were 9,500 detections in wild birds in 50 jurisdictions in the United States. Then this is poultry effective is 70 million. That's quite a number, right? In 48 states, dairy herds that were affected is 138 in 12 states. So this is a little bit the situation in the United States. Again, there is no direct concern now. There is no human-to-human transmission. This is just the situation as it is in the United States. And again, there is more to worry about than H5N1 in the United States. There have been outbreaks in the past. And I think what has improved is the surveillance for such outbreaks. And I think it is even good news that we find all these cases and that people continue to monitor this. Nobody has done that in the past, right? 10, 15, 20 years ago, that did not happen. Now we do it, and now we are aware of it, and we would be able to respond more quickly if there is human-to-human transmission. Melvin, any view from your side?
Just to add, Professor, for those who are watching, when you say influenza A, H something and something, there's so many possibilities because there are actually around 18 hemagglutinin subvariants, subtypes, and then we have 11 of the neuraminidase, right? So these
Yeah.
numbers may look weird or different, but there are so many different combinations that are possible.
Yeah. And then there are strain to strain variations. So H5N1 from cattle in the United States is different from H5N1 that was detected in China 10 years ago, right?
That's right.
Anyway, the good news is this is monitored, it is followed, and people care about it. And in case there would be a pandemic, we would be very early on, and I hope also this time better prepared for vaccine production. But before that, Melvin has a story on pasteurization of milk in and H5N1.
Yeah, so another good news I would say is that researchers within the US Department of Agriculture, USDA, and the US FDA, they had this new study about H5N1 avian flu virus inactivation using traditional pasteurization used in commercial milk processing. And the samples were subjected to high temperature short time or HTST or flash pasteurization. These are the most commonly used pasteurization technique in the US. It basically consists of heating the milk to around 161 degrees Fahrenheit or 72 degrees Celsius for 15 seconds in a continuous flow. And and all of these viruses were eliminated in the sample. So I think this is good news. Make sure that you are drinking from a source that does pasteurization, just to make sure that you're not exposed to these viruses.
Yeah, by pasteurization of milk. Many people don't like to pasteurize milk because they want to have the natural product, which implies they get the natural infection, right? And the natural infection is not only on H5N1, but here in Europe and Asia, it is also about tick-borne encephalitis. There continue to be tick-borne encephalitis outbreaks in many, many countries. And due to dairy milk, right? Even in Germany, we had unvaccinated children drinking milk in a kindergarten, and they came down with TBE. And it's not only TB, it's also listeriosis as another example. Listeria monocytogenes is another organism. And again, there's good reason to pasteurize milk. People like the natural milk, I believe, because of the taste. And they even prefer unpasteurized milk for cheese production. But still in cheese, if you ingest unpasteurized cheese or produced from unpasteurized milk, you may still come down with tick-borne encephalitis and listeria infection. So pasteurize your milk. Melvin, great point. Thank you very much. And this is another very interesting topic. It is obesity and dengue.
Yeah.
What's the story?
We have been talking about dengue several times in the past for Global Healthcast, and we even had dengue specials, right? But this is a new study that I think is interesting for people to know that obesity in children actually increases the risk of hospitalization for dengue infection. And as we've known in COVID, obesity is really not good news for COVID infection as well and COVID outcomes, right? But this is just telling us that one way to make sure that the public health impact of dengue is not that bad is really have campaigns to have healthy children and healthy adults in general, right? Looking at your weight and making sure that you are not obese.
Yeah. Yeah, obesity really increases throughout the world, and it's a big problem in young people, not only in middle age and older people, but particularly increasing in young children. Yeah. Very good point. Thanks for raising this and bringing this up and for picking it up in the literature. Now you have another topic on vaccine uptake. What's the story here?
Yes, so these are two studies really looking at the effect of social media on vaccination, right? Particularly COVID vaccination and flu vaccination. So in the first study, researchers from the Annenberg Public Policy Center repeatedly surveyed probabilities sample of Republicans and Democrats in the U.S. on their social media use, right? And basically looking at what the effect of that social media use is in their preference for vaccination. Overall, in the study, it showed that Republicans received COVID-19 and flu vaccination less than Democrats, but the influence of social media on their vaccination decision was equally strong between the two parties. So, previously we were not really talking about political affiliation as something that would be a risk factor for not getting a vaccine, right? But apparently now it is. So that's the first study. The second study, published in PLOS One, explored the psychosocial correlates of parents' intention to vaccinate their children against COVID-19. And as part of the Philadelphia Community Engagement Alliance, the researchers surveyed over 1,000 parents from 2021 to 2022 when guiding their kids for vaccination. And again, this is really interesting because it really showed that for parents, their social media use is influencing their decision to have their kids vaccinated or not. So I think in the future for researchers who are looking at psychosocial or behavioral factors for vaccination, they should now consider social media and politics.
Yeah, that's interesting. But it's the first time that I read that social media use is more increasing the acceptance of vaccination. I thought the opposite is right. I thought they read all the stupid stuff and then they don't want to get vaccinated.
So it depends. It depends on which party they are and what is their source of information. Yeah.
Okay, so it is more factors, but basically social media is an important tool to increase or decrease vaccine uptake, but then it depends on other things, on your beliefs and your background, cultural background. Yeah. Interesting. Yeah. Very good. Thanks for bringing this up. And I have, from my previous life at Pfizer, I was responsible for pneumococcal vaccines. And I always like the data from the United Kingdom because everybody, they have an excellent vaccination system, right? They don't like their National Health Service. It is underfinanced, I understand that. But their vaccination system is one of the best in the world. And what you see here is based on the population-based data, the incidence of pneumococcal disease in patients 65 plus is 35 per 100,000. And then with the introduction of pneumococcal conjugate vaccines, it went down. And PCV13, it went down. And then it went up again as of about 2014, probably due to the effect that non-vaccine serotypes emerged. Now, you don't see PPV23 here. And there are studies, in fact, to show that PPV23 in the United Kingdom has little, if any, impact on anything in the United Kingdom. If it is effective only for, let's say, 2 years, depending on subpopulations. It is probably not effective in patients with underlying diseases. And if you have HIV, from another study published in The Lancet, you increase your likelihood of coming down with pneumococcal infection. So PPV23 won't do much. So it is fair to not even have it here on the list. Now, this is the study I have down here is recently published, and it is about modeling the impact, the financial impact of using PPV 15, 20, or 23 in the United Kingdom. And now what they come up with their modeling is PCV 15 would prevent 145 cases in elderly subjects of IPD, PCV 20, 354, PPV 23, 150. I can go on to the numbers of community-acquired pneumonia or in taking only people above 65 years. And the conclusion is both PPV23 and PCV20 were likely to be cost effective, and PCV20 would likely avert more cases of pneumococcal disease in elderly and adults than the current PPV23 vaccine, and so on. The reason I'm bringing this up is just to make the point, this is a theoretical exercise. There is no efficacy data whatsoever on PCV15. So how can you assume that 145 cases would be averted? It is simply assumed that all the serotypes work. And the license for PCV15 is based only on the immunogenicity compared to PCV13. And the same is true for PCV20. PCV20 is not used in the United Kingdom in the elderly. So this is theoretical data, and you can doubt it. For PPV23, you have to know that it's a polysaccharide vaccine, and it doesn't reduce carriage of the pneumococcus in the throat. Now, pneumococcal pneumonia is the result of aspiration. If you don't reduce carriage, you don't reduce pneumonia, because you cannot. It is physically impossible. But they still come up with that many cases prevented by PPV23, and then they somehow have in their model the lower efficacy and the lower effectiveness and the shorter period of efficacy. The whole thing is really, I guess it has a high internal validity. I trust whatever they did is very correct. It is high internal validity. I have no doubt. But I doubt that the input data is correct. And again, I would doubt PPV23 can reduce any pneumonia. It can only reduce invasive pneumococcal diseases, but not, it can never prevent pneumonia. And the data for PPV15 and PPV20 are merely based on assumptions. There is this pneumococcal serotype 3 in PCV20, and immunogenicity against this serotype is even lower than it was with PCV13. So too many question marks, and then you come up with something, a very strong statement here that you read in the conclusion. I'm not sure if I can follow the conclusions. I'm not sure. Melvin, maybe you have a view here.
No, what I think, Professor, is, of course, studies like this, modeling and assumptions, they have a place in the scientific community, right? But as like what you said, I think we should really be cautious on how we apply this until we have done further studies like real world evidence, for example, right, to support studies like this. But I would say that theoretically, this is a good presentation of what could be the vaccine effectiveness, right, of using these different vaccines.
Yeah. So interesting paper from my topic from my previous professional life. With that, we talked about influenza, the global situation. The good news is we're monitoring it. We know all that is going on. And hopefully, if there is a pandemic with human-to-human transmission, we would know early on. Melvin hopefully convinced you that you should only consume pasteurized milk and milk products. He showed that childhood obesity is tied to a higher risk of dengue hospitalization. We showed that heavier social media use and political background are tied to vaccine uptake. And I showed you that the impact of pneumococcal vaccination in adults in the UK is very hypothetical because there is no data to rely this on. But the models for that exist and are out there, and we have to appraise them in a very critical manner. With that, I come to our last slide, and that's yours, Melvin.
Yes. So many of you would probably have heard about this concept, but I just wanted to show it because I really like this concept. It's pronounced as ikigai, Ikigai. It is a Japanese concept that combines your joy of life and your sense of purpose. And it's a combination of the Japanese words iki, which means to live, and gai, which means reason. So basically, if you put them together, it's your reason to live. And this is a very beautiful concept, I would say. There is no direct English translation, but the concept really looks at the idea of finding joy in life through purpose in a unique way. So once you have found your ikigai, basically what combining what you're good at, what you love, what the world needs, and what you can be paid for, that is the Japanese concept of basically reaching your ikigai.
Yeah. So basically, if you're all tied up in your ikigai, then it's all together. And if not, you have a problem, right? You have to make compromises, and you get paid for something that you may not like to do, but you have to do it anyway because you need to make a living, right?
Yeah, I mean, maybe not all these three, maybe three of them, but I guess the ideal is for all of these four to be at the same, you're doing the same thing. All
Yeah.
these, yeah.
Yeah. Thanks for bringing that up. And with that, thank you very much to everybody for joining us. If you like our show, please write us and please give us a like in our YouTube or wherever you see us presentation. And goodbye for today.
Thank you, everyone. Stay safe.